Hi there. This short mini-series is on negotiation and delegation. Two skills you really need as a nurse. Here is a definition of negotiation. And just so you know, the parties are interdependent. Neither one of them has complete power. The process is decision. It's not a contest of wills. So you have to make a good case. It's not that you're just pushing. What are some problems in negotiation? Giving in too much and then losing everything. You need to have a bottom line. Settling for too little. And again, that's the same as giving in too much. Walking away, if you get, this isn't an emotional thing. You have to go in cool, calm, and collected, and you don't walk away from the table because you're angry. And settling for terms that are worse than your current situation. So myths with negotiation. Good negotiators are born, not made. That's not true. Experience is a great teacher. That is true. Good negotiators are risk takers. Yes, they are. But they do have a bottom line. They know when to stop. Good negotiators rely on intuition. I'm not sure about that one. What do you think? You need or you have your clinical expertise. That's worth a lot. Along with your clinical expertise, you need data. You need to come and speak to your head, not your head nurse. I'm sorry, I'm blanking out here. Your nurse manager with data. We need more staff on nights because we have so little staff that we've had a couple of never events, which we didn't have before we lost staff on nights. And then have the numbers of never events. You have to maintain a patient family-centered focus. So it's not like it would be better for the nurses or I would like it better, but that this is better for the patients because. And again, you bring in your clinical competence. You talk about why this is important clinically. So before you walk in, set your limits. Know when you're going to say, okay, never mind. Ask high. Ask for much higher than you expect to get, but only settle for your bottom line. If you fail, it's because of three things. Either it's a poor idea, or if it's a poor idea for that hospital, or it's poor timing. If the nurse manager has told she has to reduce, please, the staff by 25%, and you bring up something where you're asking them to hire new staff, that's poor timing. Or you don't have good support. You don't have good data. You haven't spoken to other people, so you have all your ducks in a row. You have to be willing to say no to your head nurse, your nurse manager. My age is, I know it's hard to take me seriously with a bird on my head. Calm down and try and be quiet. Thank you. Set realistic expectations or timelines for the work to take place. Don't promise that you could do something in the first week that will take months to get in place. Sell your initiative. Describe the problem. Have a detailed description of the current practice and the new practice you want. Elicit engagement to individuals directly involved and indirectly. Speak to allies, but even more than that, speak to your adversaries. Speak to people who you think are not going to go along and get them on board. Use the group process, which you will learn about quite a bit in this program. Use your persuasive powers. Don't blame, don't play the victim, stay focused. There might be some side issues, ignore those, stay out of those. Just tell the story, just give the facts. Express, don't use any dirty tricks, and don't ever use, never use, never or always. That's not usually true. Use usually or most of the times, most of the people. Don't say nobody on the unit wants this, because all the nurse manager has to do is speak to one person who says, no, I'm kind of in favor of it, for you to lose your whole credibility. Listen, validate what you hear. One way is to say back to the nurse manager, you know what, I think this is what I heard you say. Establish responsibilities. Don't be a victim. And people buy into the leader, then the vision. So be a strong leader. Hold team members and yourself accountable. Care about what you're doing, or don't do it at all. So poker face really helps. Don't get emotional. Be willing to be wrong. Accept criticism as a learning opportunity, not as something personal. Value diversity, honesty, and certainly personal integrity. Now, delegation. I have delegation here, and I don't know how many of you are new nurses, but delegation is often difficult for new nurses. So I wanted to talk just a little bit about delegation. Delegation is giving somebody else the authority to do something. And only professionals can delegate. Only the RNs can delegate. But you as the RN retain accountability. So easy example, you might ask the nurse, the nursing assistant to take a blood pressure. But if that blood pressure is off, or if that blood pressure is sky high, it's your responsibility. You have to make sure that there's some sort of communication and parameters so that the nursing assistant knows when to come to you and tell you what the blood pressure is. And delegation is part of what we do, part of management. Lastly, say thank you. Even though it's their job, say, oh, thank you for taking those blood pressures. Thank you for doing the finger sticks. It never hurts. You have to know the 5 rights. The right task, the right circumstances, the right person, the right communication, and the right supervisor or supervision or evaluation. So again, you are going to supervise maybe the nurse's aide or a new nurse, but how are you going to evaluate what they do? Now, if it's a nursing aide you work with forever, you don't have to worry about that. But if it's a new nurse's aide, don't just send them off to do something without being able to evaluate that they can do the task. Ask these questions when you're delegating. Does my state and my hospital permit me to delegate this task? Have I assessed and evaluate the patient's current needs? Don't just say, oh, go look and see if the patient needs such and such. You need to do it. Have you assessed the nurse's aide abilities? Is adequate RN supervision, meaning can you adequately supervise that person? And another one is, would a reasonable, prudent nurse delegate this task? If you're not sure, ask an experienced nurse for advice. And lastly, have I communicated to the nurse's aide? This is really important. You have to give the whole parameters, not go take a blood pressure and then 2 hours later you find out that they haven't taken the blood pressure. It's like, go take the blood pressure. I need it within 15 minutes. If it's higher than such and such or lower than such and such, report back to me. Why tasks don't get done? The employee, the one you delegated to, doesn't understand the task. They don't have the skills to complete the task. They don't have, I'm trying to shut something off and it's not, they don't have the resources. They don't understand why the task needs to be done. They don't know how to deal with an obstacle. So it's like, okay, I need you to take their blood pressure, and then they see that the patient's eating. So you have to say, if you've said report back to me in 15 minutes, or let me know if you can't do it, and they come back and said they're eating, you can say, well, it's more important that you take the blood pressure, or as soon as they've finished eating, please take the blood pressure. They don't think the task is important, or they don't want to complete the task. If they don't want to complete the task, that's certainly a whole other issue, and then you bring that to your nurse manager. Thank you for listening to this video, and good luck.